Hey, this is not so complicated, presenting you 5 minutes 5 high yield drugs. This is the first of the series containing cardiovascular drugs like Atenolol, Lisinopril, Amlodipine, Furosemide, nitroglycerin. So let's begin without further delay. The first one is Atenolol, which falls under the class beta 1 selective blocker, and the uses of this drug is hypertension, angina, post-MI myocardial infarction, rate control, obviously. And the mechanism of action of this drug is that it blocks beta 1 receptors, reducing heart rate and contractility, and that will reduce the cardiac output, right? So the side effects are bradycardia, fatigue, bronchospasm less with beta 1 selectivity, but still bronchospasm is there. So the USMLE poll for this drug is that it is contraindicated in asthma, bradycardia, and also we have to monitor for masking hypoglycemia in diabetics. And the example of the use is that post-MI patient with tachycardia gets atenolol to reduce myocardial demands, right? So the another drug here is lisinopril. The uses are hypertension, heart failure, and diabetic nephropathy. The mechanism of action is that it inhibits angiotensin converting enzyme, ACE enzyme, which usually lies in lungs, and it thus reduces angiotensin 2, thus lowering blood pressure, and the lowered blood pressure will ease cardiac preload or afterload. So the side effects are cough, angioedema, and then hyperkalemia and hypotension. The cough is brassy cough in this case, right? And hyperkalemia is a serious side effect, so we have to consider that. So the USMLE pearl is that it is contraindicated in pregnancy due to fetal toxicity, and we have to check potassium and creatinine regularly to manage if there is hyperkalemic episodes, right? So the example use is that the heart failure patient on lisinopril to reduce afterload. Okay, the another drug we have is amlodipine. It belongs to the class dihydropyridine calcium channel blocker. The uses are hypertension and angina, and the mechanism of action is that it blocks vascular smooth muscle calcium channels and thus causes vasodilation. The vasodilation will then reduces peripheral resistance, and the peripheral resistance is actually what it is a component of blood pressure, right? Blood pressure is cardiac output multiplied by peripheral resistance, so it also controls blood pressure. So the side effects are peripheral edema, gingival hyperplasia, and flossing. This gingival hyperplasia is a very specific side effect, so you have to remember this. And flossing is due to vasodilation in face, so redness of face appears, right? And then the USMLE fall for this drug is that it is preferred in elderly hypertension, and it is avoided in heart failure because of its minimal cardiac effects, right? So the example is that hypertensive patient with angina is treated with amlodipine for vasodilation. The other drug here is furosemide. Furosemide is a loop diuretic, and it is usually used for pressure control, right? Blood pressure control. So the uses are heart failure, edema, and also acute pulmonary edema. The mechanism is that it inhibits sodium potassium 2 chloride cotransmitter in loop of Henle, and that is why it will increase urine output. An increase in urine output will lead to the reduction of preload, right? So reduction of preload is reduction in venous return, thus it decreases the cardiac load. The side effects are hypokalemia because the filtration rate is increased in this case, and also ototoxicity because there is potassium is present in our ear, in our middle ear for hearing, neurosensory hearing, right? And also dehydration can occur. The USMLE pearl for this drug is that we have to monitor electrolytes, especially potassium, and ototoxicity risk with higher doses. The example treatment is CHF patient with edema gets furosemide for diuresis. The last of the drug is nitroglycerin, which is vasodilator, which is nitrate vasodilator. The uses are in angina and also in acute coronary syndrome. The mechanism is that it releases nitric oxide, which is obviously a vasodilator, by the action that it increases CGMP, and that will dilate veins, reducing preload, and also coronary arteries, that will increase myocardial perfusion. The side effect of this drug are throbbing headache, hypertension, and tolerance with continuous use. And also the USMLE poll for this drug is that it is sublingual for acute angina. We use sublingual doses for acute angina, and we have to avoid with PDE5 inhibitors like sildenafil because they are also vasodilators, and if these two vasodilators are taken together in duration of 24 hours, then that causes severe hypotension, right? So the example is patient with chest pain takes sublingual nitroglycerin for rapid relief. So that is all. Subscribe for daily doses like this. Thank you for staying with me.